my wife and I had identified in the course of our lives the Chinese tradition, the Confucian tradition, as providing much of what we took to be religious in our lives, as it were, ethical in our lives, moral. And that tradition has some remarkable ideas when it comes to the sorts of issues that I'm raising now. And one of them has to do with the respect you have for somebody else, that your own humanness deepens as you engage the humanness of somebody else. And there's nothing quite like vulnerability and difficulty to bring out that humanness. And so the humanness is in the relationship. And hence the relationship we had, even though from the outside it seemed, gee, this should be a disaster. Your wife can hardly recognize you. She can't interact the same way that she did before. And yet I found that relationship became increasingly tied to my moral view of things, that I had enormous respect for her, that I felt that it was crucial for me to help her maintain her dignity, that there were all kinds of practical things I would be doing during the day that actually made me feel better, so that you could say, gee whiz, helping someone get dressed, helping them bathe, that must be an incredibly frustrating way to proceed. And it can be that. But I also felt it was self-strengthening in some way. It reaffirmed my love and my commitment to her. And I think the other part of this that was very important was the emphasis on the actual experience itself, of actually doing it, that it was in the doing that I felt I was a caregiver, not in thinking about it, not in talking to people about it, but actually doing it. The acts themselves I saw as moral acts, as acts that brought together value and emotion together. And I felt stronger after those acts as a person. I think caregiving for serious illness like this, and especially for dementia, draws you into an enmeshed relationship with that person in which you begin to sort of lose the sense of your own self, because you're constantly entering their space to do things for them. And they become much more part of your own sense of self. So they're backing off at some stage. And that has to happen when you make the decision that you no longer can handle things and they're going to have to go to be in a nursing home. Backing off at that time becomes very, very difficult. And I found that to be quite difficult. And to find the right distance then with someone, I think is the second sort of a follow-up question. What is that distance? When we think about love, we think about love in the context of two people who are also individuals. And the love links them, but on the other hand, they have their individual lives. But love in the context of caregiving is much more complicated than that, because the independence of that other individual is becoming weaker and weaker. And in order for you to take care of them, you're entering that space of the person. Your own subjectivity becomes part of their subjectivity. Their subjectivity is part of you in a way that I found, well, I think the only word I can find is enmeshing. That is, I found myself entangled in some way, in some very fundamental way. And I think that entanglement worsens the sense of sort of physical energy going, emotional energy being drained. And then when the time comes when you no longer can care for that person, it requires skilled nursing and the like, that care. Building the right distance then becomes a problem. And that's what I'm actually working through right now, as my wife has been in a nursing home for about a month, finding what is the correct distance. This is one of the great lessons of life that I've learned, and that is that caregiving is one of the fundamental building stones of our world, but that it's frequently camouflaged. Why is it camouflaged? Because we simply take for granted it's going to be done. We take for granted that women and men are going to take care of their kids and raise them. And that's an enormous area of caregiving. We take it for granted that in the course of a marriage that partners will take care of one another. We take it for granted that as people age, decisions are going to be made, supports are going to be in place, that even if you go into assisted living, even if you go into a nursing home, there's going to be some kind of a system of care relationships that's going to be there. And my feeling is that this is one of the most extraordinary parts of society. Society would fall apart without this. What are the supports for caregiving? Do we hear about it in the news? Is there policy oriented around it? By and large, not. We just went as a society through a major debate about healthcare reform, which came out to be a debate basically about healthcare financing. How much attention was given to the nitty-gritty of caregiving, the content of caregiving? I would say almost zero, okay? Almost no attention to that. And yet this is what families are going to face in the future. This is what the future is as you age, as you require care. And I think that this is where we need an enormous amount of attention. We have to say we have left out of our thinking one of the cornerstones of society. We've just simply taken it for granted, and we got to rethink it. We have to rethink in terms of, is it going to be the case that we simply will have inadequate caregiving in the future? We won't be able to maintain it because of simply the demographics of caregiving. What about the resources for caregiving? I'm fortunate. I'm in the upper middle class. I can afford a lot of things like a home health assistant. Supposing you can't, supposing you're poor, where are the resources for that? If we look at who does the caregiving, in itself, it's an extraordinary comment in our society. You look in the area of Boston, who does the caregiving? Haitian Americans, other immigrant groups in the United States. There's a tradition in the Irish community of older Irish women who play an important role in this regard. These are important groups that make a crucial contribution. But one of the things that you see about this is most of the people involved are women. They're often minorities, and the support that they receive is quite limited. And so I think there's a whole domain of caregiving that needs to be rethought from policy, from research through policy. Caregiving has almost nothing to do with medicine. And that was an eye-opener to me because I spent my whole career trying to build caregiving in medical education and the like. But it's the fact of the matter is that physicians are so busy, they're so technically involved with diagnosing and treating the disease process that they have very little input into the illness experience and its care. Primary care doctors do, for sure. Pediatricians do, okay? But the specialists in internal medicine and in surgery, et cetera, they just don't get engaged with this. And so who does the caregiving? It's not the physicians, okay? And actually, the nurses make an important contribution, but usually they're limited in number and they are not doing the hands-on caregiving. It's the home health aides. It's the aides in the hospital. These remarkable people who are doing almost all the caregiving. And what we know about them is very, very limited. And the other thing we know very little about is we know very little about families and family caregiving. I was astonished when I tried to read up on it as I was doing it, how little we know about this. And so, you read something that says for the elderly in our society, about 70% of them either live on their own or are cared for by their family. 70% of the elderly in our society either on their own or cared for by their family. But what is actually happening in those settings? How do they care for each other, say an elderly couple? What happens with the children, the adult children? Almost everything that I experienced, I found very limited resources to tell me about. So that this is an area of enormous importance that needs to be better researched. We need much better knowledge about what actually takes place, what are the challenges, and what are the best ways of dealing with them. Well, somewhere in Shakespeare, he says, love is not love which alters when it alteration finds or bends with the remover to remove. I mean, it is love. It's about the fact that you're there. This was the deal you made when you got married. The deal was to be there for that person, them for you. And you had to be there. You were there. You did it. You did it because it was there to do. And didn't think much about it, at least in my case. You had to do it. It had to be done. I had to do these things, and we did them. And I think that the firm basis for that was the love I have for Joan, and the fact that our relationship turned on a moral commitment to each other, that we were there for the other person. And she'd always been there for me, and I had tried to be there for her. Is there a religious side to it? I was suggesting this earlier when I said that I come out of a Jewish tradition. Joan comes out of a Christian tradition. She sort of Protestantized me in some way. And, but I think that the core set of values that became the basis for our family and for our lives came out of the fact that we devoted our academic careers to working on things Chinese and not China. The deep commitment to family, the idea that the family was central to everything that you did, the idea that you were building with the family, that you were building for the future, the idea that your emotional relationship was not just an emotional relationship, but was a moral relationship, that you had values that needed to be supported along with feelings. I think that was very central. I make a distinction between the disease and the illness. It's not something we usually do in everyday life, but it's a simple distinction, where the disease means those biological processes that the doctor is thinking about is going to try to control through medications and try to monitor over the course of your care. But also the illness is different from the disease. The illness is the experience you're having. Okay? So the disease is the fact that your heart as a pump is failing. But the illness experience is the fact that you can't get up the set of stairs that leads you from your living room to your bedroom. That's the illness experience. And you want the doctor, it seems to me, to be as concerned with the illness experience as he's concerned or she's concerned with the disease process. Okay? And I think that that is not happening most of the time. That the concern for the disease process becomes so overwhelming to the practitioner, and not just to the doctor, maybe to the nurses too, that the attention to the illness experience is weakened. And I think that that's where I see family caregiving being critical. That family caregiving is about the illness experience. That's what people are engaging. That's what they're trying to do something about. I have two fields, anthropology and medicine. In anthropology, there is the idea of that you learn through participant observation. You observe, but you got to participate. Okay? If you simply observe and don't participate, you're not in the real world. And that's my understanding of caregiving. That caregiving, when you do it, you're participating and observing. And that's how you're learning it, as you do it. When you talk about it idly or just in reflection and the like, as an abstraction, you somehow disassemble it. It's not there as it really is. It's really there when you do it. And that's what my sense is of the importance of experience in caregiving. That you cannot understand caregiving unless you participate in that experience of doing it. If religion is ultimate meaning, which maybe is the best I can think of how to define it, the fact that ultimate meaning for me and for Joan was in our relationship with each other and with our kids meant that there was a religious quality to what we were doing, and that this religious quality was what I meant when I said that I experienced something as empowering, as strengthening. I felt strengthened as a person, And the best way I can put that is that everything that was meaningful to me got caught up in these actions. And the practices themselves became the moral experience or the religious experience. Those practices, the doing of it, was more than just the acts. So that I tried to think about this at one stage through the idea of presence, that you're present to the other person. So much of the time, we're not present to another person. We're, you're writing the prescription when you're looking at the patient, half thinking about something else. Or you're with your wife and you're thinking about something else, maybe the work you left behind, maybe the vacation you didn't take, or something like that. Being present in the act itself of sort of bringing you forward. I've always thought about this as like most of the time we're sort of a hand entering a glove, but we don't necessarily bring the hand fully forward. And my feeling is when you do these acts, the hand has entered the glove. You're fully forward. You're there with that other person. I think that presence is crucial. And that's what I recognize now in my own professional life that is different about professional caregiving. That in professional caregiving, sometimes you're present and most time you're not, okay? Because that presence calls something out of you that's not so easy to do when you're doing it constantly with strangers. It's much easier to do when you're doing with someone who is extremely close to you. But I'm suggesting that there's something remarkable about that feeling of being present with someone else. And I felt that for a long time in our relationship. And I felt that deepen as there were more acts for me to do in this. I would take that to be in the sense of ritual or practice, a religious act. That you yourself are bringing yourself forward as a person into this. And that's why I think, again, that rather than feeling overwhelmed or vulnerable or defeated, which are transient ideas you get from time to time, I felt generally strengthened. That this made my life deeper, richer, my commitment more real. I think that all of these things came forward for me and were crucial to my experience. So actually looking back on it, if I had to say, well, what are the religious experiences in your life? It's not going to temple or church. It was actually these acts of caregiving come as close to what I think religion is as I could name.